Hey, everybody, welcome back to the Monday Afternoon Journal Club. Ed Bouter and Dan Schwester here from the Overrun. Dan, let's talk about babies today, shall we?
Yeah, let's talk about those little chicken nuggets.
Let's talk about babies. So we want to talk about this study. It comes out of pediatrics. This is April of this year. This is Sophie Triboulet. This is coming out of Belgium because we are an international group here. And what Dr. Triboulet wrote here is the standardized management of the first hour in premature infants. And they did a meta-analysis, and devotees of the show will know that we love us a good meta-analysis. So big picture here, because this is an in-hospital study. This is not a pre-hospital study, and goodbye to everyone that just logged off the show. So what they talked about here was, the reason that this study is important is it talks about how to properly care for premature deliveries, right? Not something that we see a lot in the field, not something we deal with a lot in the field, but they are working toward this golden hour type of philosophy, which is similar to trauma. Mm-hmm. So in this meta-analysis, they did 12 prospective and 6 retrospective studies, a total of 5,104 patients, really great N. And when we talk about, we've done this journal club for a little over a year and change now. We've talked a lot about, there's 7 different problems that can be caused by this, or this treatment can cause 4 different things. In premature infants, hypothermia, fix it. That's where we're at, right? That's the whole thing as it applies to EMS. The conclusion of this study was the application of a golden hour at birth reduced the risk of hypothermia and the time required for intravenous infusion without statistically significant impact on glycemic control, which means that the baby is still able to metabolize things effectively. Yep. So when we have premature births in the field, because birth in the field is horrible universally, no one particularly enjoys it. It's not a great experience. It is for the parent. And wonderful.
Are you referring to our last birth together?
Listen, births in the field happen all the time. So, but what works effectively is really the question, right? Because I think that we try to explain to people like, hey, you've probably had this great birth plan when you get to the hospital. Now here's the new plan. Sorry, we're in the back of an ambulance, and this wasn't part of my plan today either. So given that chaos, it's very difficult to effectively treat a newborn and a pediatric patient in the back of an ambulance. It's real easy to kind of lose sight of what the goal is. And this golden hour concept, I think, streamlines everything, makes everything a lot easier. There's a baby in the field, keep them warm. At the end, right? The warmth is what's going to lead to the breathing, to the cardiac activity, to all of that stimuli, but you have to warm them up first. And I think that having these types of guidelines, this type of golden hour idea is a really, really effective thing that we can translate to EMS.
Yeah, I agree. And the thing that I took from the study, and the thing everybody should take, is these babies, even if they're term babies born in the field, we should look at every one of our births in the field as a premature infant. And that kid, that little nugget there on the stretcher, that ambulance needs to be blazing hot. If you're not sweating when this kid gets delivered, it's too cold. Nobody should open doors. In fact, lock the doors. Nobody should be opening up doors to look in or see what's going on, because you'll lose heat. It's all about heat. Get these kids wrapped up, get them if you have a purpose-made blanket for them, or if you have something, if not, wrap them. Remember, you get the head. Learn to make a good swaddle. It's a good thing for these kids. Hypothermic kids do not metabolize well. They don't clot well. And that's really, really dangerous in the first stages of an infant learning to live outside their mom's body. We got to do this stuff. And here's a really good study that looked at a lot of different things and found, hey, the most important neonatal resuscitation is keeping them warm. Don't worry about, is it doing suction here, suction here. That's not as important as keeping that baby wrapped up, safe, warm, normothermic. If you're sweating in the back of the box, that's probably the temperature it should be.
And before we hear anything else for it, like obviously we're talking about suctioning the airway and doing all that airway management and all of that. What we're suggesting is that if you do that in the absence of keeping the patient warm, all of your efforts will be for naught. So, this is something that kind of stands to reason, right? This is one of those things that I think makes sense naturally that we tend to kind of ignore, right? You have to consider the physiologic status of the child. So that baby has been inside literally an incubator for, we're presuming, 9 months or less than 9 months if they're premature.
A perfect environment.
As may have been.
A literal perfect environment.
If they're premature has been looked at, it's 8 months, whatever else. Consider how you feel when you're inside your nice, warm, toasty house, and then you walk outside in a snowstorm in January.
Right? Naked.
The first thing you want to do is be, right, exactly, and you walk out naked. and wet. So the first thing you'd want to do is be warmed, I'd imagine. So, when we talk about identifying with our patients, right? If you have someone who's an adult and they've got a really bad abdominal pain, you've probably had abdominal pain. You know how that feels. You can empathize with them. The reason that babies cry when they're born is because their entire life has been inconvenient and uncomfortable. So I get that. I completely understand it. I feel the same way at 40, having to wake up in the morning for work. So, I am, when you see a baby crying, you're like, why? What do you have to be so upset about? Like, everything has been terrible so far. So that's why you want to take the kid and warm them up and make them comfortable, if nothing else, right? We can get into the physiology and the metabolism and how it's going to affect their clotting factors down the road and all of that. But in the end, if we're trying to be a field and a practice where we make patients feel comfortable and feel better, that's the first thing that you have to do, right? Dry that baby off, warm them up, make them more comfortable, if nothing else, because then the cacophony of children crying won't be filling the back of your ambulance.
Mm-hmm. I think that's a good way to look at it.
Yeah, and I think that's kind of the biggest thing. So again, this is Sophie Triboulet et al. Coming out of Belgium, telling us that the most important thing we can do is keep our babies warm. Let us know what you guys think. Do we have warmers in the back of our ambulance, or are we just using the back of the ambulance room temperature blankets to warm children? What are you guys using in the field? Let us know what you guys think. Subscribe down below, click the bell, check us out on EMS One, listen to the Overrun podcast at Apple Podcasts and Spotify, and let us know what you think for everything, and check out the article down in the show notes for the Overrun and the Monday Afternoon Journal Club. Ed Bouter, Dan Schwester, and we will talk to you all next time.